Thank you so much for tuning in. I'm Amitha Balachandra. This is the 6:30 p.m. show that I do every single day. This is a very, very important conversation that I'm going to be having today because it's very little spoken about. While we're talking about how COVID 19 is affecting everybody physically and emotionally, we haven't paid as much attention to the differently abled. And this is extremely important because, according to the WHO, it has estimated that about 15% of the world's population experiences some kind of disability, and yet there isn't enough talk about it. Now, let me take you through a study that's come up by Rising Flame and Sight Savers, which has now looked at effects of COVID 19 on women with disabilities. And it's reported that at least 50% of the people that they surveyed had problems due to work and livelihood, that there was a problem with access to technology, there were problems with mobility, and even sustainability. UN, in the meantime, has called for greater inclusion of persons with disabilities. And so, what we're going to talk about today is first of all, what are the problems that people who are differently abled are facing at this point, especially because of COVID 19? And what should the government be doing to be more inclusive? And to have that conversation with me, I have two people joining me right now. One, Devangi Dalal, an audiologist and speech therapist. She's also the co-founder of Josh Foundation, and she has experience of over 28 years. So I'm very, very happy and glad that Ms. Dalal has made time for us. And I also have Monisha Shah, who is a sign language interpreter from IHS News, which is an online news channel for the deaf. They also broadcast daily news content to ensure deaf individuals are up to date. So, thank you so much for both of you to make for making time to have this conversation. Mr. Lal, I'm going to ask you this: because of COVID 19, what are the problems that people who are differently abled are facing? Are they largely forgotten and neglected?
Yeah, first of all, I would like to say thank you for inviting me. And today being a International Day of Persons with Disability and National Disability Day, I would like to wish all the special people in India and abroad that they stay well and healthy, and they have a good future ahead as we are going to talk about it. uh, when the COVID-19 started, like 2 months lockdown, everybody was at home. In June, we started working again, and what we found that majority of the children, because they were just at home, they were not. I mean, especially when I work with the hearing impaired children, they were not wearing hearing aids at home because they were just at home, and rather it was very important part that parents would have done a lot of communication with them and would have interacted. So when I'm dealing with especially underprivileged children, the parents were not aware, how to deal with the children. Apart from that, from the school, the support started, but then support was very limited because those schools who are running the special schools for underprivileged, they don't have a facility of computers and all those things, and those who are staying in a very small area, so the access of except mobile, there was not much access. So the what is happening is like last 6 months, like how any other normal children are getting educations on the computer, these children are not having that communication. And because underprivileged parents were not aware that how to deal with it, and most of them have gone to native place. So I think the whole period of that 6 months to 8 months, what normal people have done some still activity, but this disabled children have gone away from the all activity as far as education is concerned, communication with people is concerned. So it's going to be a major effect for them to overcome again. So that is one biggest issue, that period which has gone, how they can overcome. Second, the thing is that when I talk about the hearing impaired children, most of the children are working with a sign language and gesture language. They are not able to communicate with the people, so they just have to rely to learn from their parents because other people doesn't communicate with them. So again, there is a issue of less communication, and the when you come to know when you come about hearing aids from the government, there are standardized hearing aids given in this schools. So this hearing aids doesn't give enough input to the child, so they are not progressing. So I mean, there are a lot of issues which we can talk about, but these are the major issues that they have been away from the education for almost 9 months.
So essentially, a lot of people are asking about sign language also in the chat window, and what Monisha is doing is basically that interpreting everything that Devangi is saying. And if you can, I'm just going to ask you an off question because some of the people here are asking this: why is sign language so important for people who are deaf?
Uh, I mean, frankly speaking, in my last 29 years, all the children who I have screened for hearing, they have some residual hearing. And most of the children who have visited to our institute or our organization, we have tried to help with the hearing aid. But of course, we have not been able to reach to the masses, and the people are not even aware about it. And there are poverty and misconceptions, and there are restricted thought process about the hearing aid. Now, in the market from 1998, digital hearing aids and even the cochlear implants are available. But people are still saying that, why to spend money for the hearing aids or the cochlear implant for these children. So, sign language is a support system, or lip reading is a support system for these children, to interact. But frankly speaking, if we pay attention to it, government pay attention to it, I would like to tell you that in all the countries, almost 80 countries, there are pediatric protocols available from the government for the hearing impaired people, as well as they have started neonatal screening. So the hearing aid given to the children is within 6 months, and the next auditory memory period is lost. So within 6 months, they get hearing it according to their requirement, and the parents start conversing, the whole team works for them, and by the time say 2 years, how normal children can talk, they can talk. So like in those 80 countries, they are able to reduce this handicap by 20 to 40% time, which in our country is still that pediatric protocol has not started. There is no neonatal screening available for, so we are much behind. So I think the awareness is the major issue, where there is not much work done for these disabled people, and especially when I talk about the hearing healthcare.
I also want to ask you this. Now, all of us are, of course, the fact that there is COVID-19, there is a fear of getting COVID-19 as well. And how has this impacted people who are differently able, especially when it comes to mental health? Has it sort of compounded anxiety issues and people who are wondering what to do now? Of course, we've spoken about lack of access, but I also want you to talk to me a little bit about mental health as well.
There was one major issues which we observed, that even normal people who had a little bit hearing difficulty because of wearing mask, they were not able to hear very well. So the wearing a mask and communicate, especially dealing with hearing impaired children and mentally challenged children, was major issue which was affected, that they were not able to communicate because of the wearing a mask, and of course they feel suffocated. First, they are not able to understand the communication. They are not having emotions. So I had like recently one child who was sitting at home, and it so happened that hearing it stopped working, and they could not come for almost 2 months to repair the hearing aids. And that boy did not have any activity at home, and it got so frustrated, and mental health issue has reached to such level that the violence has started happening in the family. He started beating the family. So the major issue is that there was no activity for them, so that has created more frustration and mental issues for them. So we have to also work on that, as soon as the pandemic gets relieved. I mean, it's a major issue which has to be looked at.
I also want to ask you, in your conversations with different people, was there also a hindrance in, challenge in accessing important information? Because there was a lot of instruction that was coming in as far as COVID-19 is concerned, and every day that information changes. So, was there a hindrance in getting important information as well?
There was one very nice thing happened those especially in urban area where parents are little bit aware about how to deal with the COVID-19. So they as a parents have explained to the children. So in urban areas it has not been a major issue, but of course rural areas I had a discussion with one of the small town in Gujarat where the even parents were not aware about how to deal with it. Actually, I had recently two children who were the spastic children and mental retardation as well. And the parents say that we just don't know because the school we don't have access online and there are no activities. So what we are doing is just doing a sports what activities which has been taught to us at home, and we are just doing that and the children are not able to do anything further. So I think there is a stagnancy. I mean, the saturation level has come where they don't know what is the way ahead for them.
I also want to talk about a report that's come in India Spend. I will put this up on the screen, but India Spend has reported that people with valid health insurance were also not able to claim insurance in some cases. Have you also heard of cases like this? And if so, why is this happening?
I'm not aware about the insurance part dealing with the hearing impaired people, but of course there is one. There are a lot of things which is available for the hearing impaired people from the government, but I think people are not aware about it.
Hmm.
I think the lack of information and awareness has not been created. So I think I mean, I have not come across, but majority of the people who have a disabled children, they must have found difficulty, for that because I mean, even getting a hearing aids to the requirement, or having a transportation facilities, as well as education facilities in the higher education, employment issues. Everywhere there are certain quota available from the for the disabled people, but I think it is not reach that information to the people who have the disabled children at home. So I think there must have been a very less help in the insurance part also. I believe so.
I also want to ask you this now, with the UN saying that we need to be more inclusive. What do you believe that anything has been done at all by the government? Has COVID 19 sort of been a setback for people who are differently abled? And what can we do to be more inclusive?
I mean, as far as our country is concerned, and as you mentioned that how many 15% of the people having disability, and I mean, when I talk about the 6.3% population of hearing impaired in our country, only 10% is getting a proper treatment. So, and apart from that, due to COVID-19, that has been affected very badly because they don't have a proper education. There was no online education available. Of course there was no employment. I mean, still employment for normal people is difficulty. So how this disabled people will get the employment in different institute or the corporate companies, uh, and also like support from the government for this disabled children is very minimum. So for parents it's going to be a very difficult task, how to work further on it. So, as an audiologist and a professional working from 29 years, I feel that we all have to come and work together, all professional, government officials, and even the parents as a team, that we have to become aware that how to deal with each and every disability. There are a lot of things available. There are a lot of data available where we can study. We as an individual can pass on the information. I mean, in last 1 month, we have given hearing aids to the requirement to the children, to almost 30 children, and we guided them that how one should educate it at home. and how these hearing aids are going to help them and how the children will speak. So they have been like feeling so much relief that now something can be done for their child. So as a parents, professionals and government, we all have to work and go down to a base level of all the disability and make a awareness program and make them guide that how one can work for each and every disability. I think how COVID has made us understand that physical and mental health is very important. Is the same way for the disabled children. Also, the physical health and mental health is important, and that is possible. Like how we are supporting each other for food, nutrition, and for everything. I think every individual has to come forward and support. And especially when I deal with the hearing impaired people, I feel that. Specifically here, and my Jewish Foundation motto is hearing disability is no more a disability. So if one person helps one other disabled person, I think the world today only, being a international day, I felt that world will have a best kindness if we all make hearing all the disabled children inclusive of the society. I think and every individual can help one person.
And apart from the fact that we all have to help each other, what is the thing that the government needs to do at this point? Because according to this report by Rising Flame and Sight Savers, it says that the government is not paying enough attention. So, what can the government do at this point?
Um, Again, as I said, that government has a lot of facilities from the health ministry and the social welfare ministry, and the how the technology has advanced in mobile phone and electronic devices. The technology has advanced for all the disabled people also.
Hmm.
So I think government makes a person concerned available who a team who knows everything, the new technology and how to deal with it, and form a certain assignment and protocols for each and every disability. I think and start working from the base level. I mean, I will tell you a simple example that when I am talking about the hearing impaired people, there are around more than 450 special schools in India. So if all the schools, the correct diagnosis done for all the children, they are given hearing aids or cochlear implants to their requirement, and the parents and teachers are counseled how to deal with them, and then to integrate them into the normal education system and higher education, and then into employment. I think if that protocols are designed for each and every disability, the the things from the government and the help of professionals and working with parents, it will become a smooth process. I think it has to change from the base level now, since technology has advanced so much. I mean, see, within a span of time when the COVID-19 happened, we all have started learning to work on online, and we have used technology in best of the manner. Today I and you are talking on YouTube, and I think so many viewers are listening. So I think the same technology has to be implemented for the disabled people also, and I think it's not so difficult how we learn so fast. If government and all professions and everybody will work together, we'll be able to work on a very large scale and a very fast way. I mean, it's not going to be a difficult task.
All right. So, two important points made there. One, of course, is the fact that technology has to be upgraded because currently we're all doing everything online, very, very rightly put. And second, an important note is that all of us have to come together and work as a team, including peer groups and parents, and building awareness is what is required to be more inclusive because it's time we became more inclusive. Ms. Dalal, thank you so much for joining us, and Monisha as well. A lot of people in the chat window saying that Monisha, you're doing an awesome job. So thank you so much for helping us interpret that as well. And for people who are watching right now, Ms. Dalal's work and Monisha, who's from IHS News, all of that is in the description at the bottom of this video. Go take a look at it if you would like to, and please pass on this message because it's important to be inclusive, and it's time we did that. Thanks so much for watching.
Thank you for inviting me.